Good day, everybody. My name is Dr. Simon Wong, and I'm an intensivist working in Sydney, Australia. Today, we're going to talk about the initial approaches to tracheostomy emergencies, particular for junior doctors and first responders. Having been a junior doctor myself not too long ago, I understand completely how overwhelming and confusing it can be as the first responder arriving at all code blues, let alone one that involves a patient with a tracheostomy. The fact that trache emergencies are so rare, and yet with such high mortality and complication rates, if not managed appropriately, brings fears to even the most seasoned intensivist. Hopefully, after this short presentation, you will have a rough idea on the things to do and things to be aware of in the first 5 minutes when faced with trache emergencies before help arrives. You're called by a nurse to review and help a patient because they notice the trache patient has become more and more distressed. Breathing is more labored, she's more tachycardic, and they're worried something's wrong with their trache tube. What do? Immediately upon entering the room, there are a number of things and items that you can look at. First of all, if they're connected to any supplemental oxygen or to the ventilator itself. Second, review the monitor for saturation and available end-tidal CO2. Towards the back of the patient, there can be valuable information regarding the tracheostomy and helpful algorithms. If there is an emergency trache box and spare devices available within the room. And finally, if there are any suction devices available for us to use. Let's look at each of them in a bit more detail. Regardless of the situation, you should apply 100% FiO2 to the patient, either by the ventilator if the patient is connected to one, or with a trache mask over the tracheostomy site, and via 15 liters non-rebreather mask over the mouth. Remember, oxygen is good. If you suspect there's something wrong with the ventilator itself, for example, if their alarm is blaring or if there are any error codes, immediately disconnect the patient from the ventilator and connect the trache to a bag valve mask. Once again, provide 100% FiO2. Remember, oxygen is good. The monitor can give a wealth of information at a glance. The oxygen saturation can give you an idea on how much time and urgency the situation is. Obviously, the lower the saturation, the more dire the situation. The end-tidal CO2 provides two important pieces of information. Number one, whether or not there's air going in and out of the patient, and therefore we have a patent airway. We have time to troubleshoot the problem. Number two, depending on how senior you are, you may be able to interpret the various waveforms of end-tidal CO2. I wouldn't bother too much about that. Just remember the most important thing is if there is end-tidal CO2, it means that the patient is ventilating and some sort of gas exchange is taking place. We have time. There are usually a number of posters pasted on the wall behind all trache patients. They provide crucial information on the patient's status, the type of trache, as well as a troubleshooting algorithm. I won't go into the specifics of the algorithm itself, but it can be found as part of the pre-reading and preparation for your airway course. The most important information you can see is when the procedure was done and whether there is a patent upper airway. These two things will affect the management and approach to the trache based on the algorithm pathway. Pull the algorithm off the wall and go through it step by step. Voice out your concerns, gain control of the situation as the team leader, and make sure everyone is on board to know that this is an airway emergency. But remember, while checklists and algorithms are helpful to offload cognitive load in stressful medical crises, they only serve as a guide to your own clinical experience and skills. Do not blindly follow the algorithm without critically thinking what you're doing. They only serve as a visual aid. Along with the posters at the back, all trache patients should have around them an emergency trache box. Inside the box are spare device parts that can be used in emergency if you want to replace the device. Well, there you have it. The key thing to remember is that there are a number of things and steps you can do in the first couple minutes that can help stabilize the patient until help arrives. Knowing these first few steps can mean the difference between a good and bad outcome.